8:35 now, and we are on to our weekly Health Watch segment where we discuss all of the trending topics in the medical world. Sending things over to FOX61's Tim Lammers for more. Good morning.
Good morning. As always, joined by Dr. Syed Hussain from Trinity Health of New England. Good to see you again, sir.
Likewise, Tim.
Glad to have you here. As always, when we're talking about COVID, there's always a new variant coming out. It seems like each successive one gets maybe a little more contagious, but a little less severe. And I guess JN1 is the latest variant, and they have determined, the experts, that this indeed is not any more severe than any other previous variants. So how do we sort of classify the risk levels that Americans in general?
Sure. So there's some preliminary data that was released, Tim, that indicates JN1, which is responsible for a lion's share of infections that we've seen over the last several weeks during the winter peak for COVID-19, is not necessarily causing more severe disease. This is based on hospital data. Hospitalizations for COVID-19, as we've discussed before, have gone up. Now, the good news for viewers is all respiratory viruses are trending in the right direction. They're going down now. Nationwide, and we'll keep a close eye on influenza in particular, because in previous winters we've seen an uptick after it started trending downward. So we're still not out of the woods yet. People who are high risk need to take precautions. It's always good. I always say that. But JN1, based on preliminary data, does not indicate that it's causing a more severe disease.
Okay, some relatively good news there. Let's talk about cervical cancer. Thanks to HPV vaccination and other efforts, I've heard other doctors say we might be able to eradicate that in our lifetime. And my understanding is cervical cancer rates for women in their 20s, pretty low. But for women older, in their 40s and above, they might be going up. Do we know why?
Yeah, a couple things to unpack here. I want to start off with good news. The good news is those younger women in their 20s in particular, we've seen a 65% decrease, Tim. Yes, it's huge.
Huge.
And that's mostly attributed to the HPV vaccine, which girls are supposed to get in their preteen years, 11, 12, all the way up to age 26. And that's led to this big drop that we've seen. However, in the 30s and 40s, we've seen a 2% increase. And we've had many years of successive decreases. So the increase is likely because it's multifactorial. It's also because these women have not received the HPV vaccine. They were out of the age period that I just mentioned. But also screening. We've seen screening go down. So it, again, goes back to the same premise that I always talk about of how important it is to get those annual wellness visits and primary care appointments set up so you can get your pap smear. Now it's every 3 years for women above the age of 30 into 65. Or a test that can be done in conjunction every 5 years.
So the rates are going up because screening was going down. Sometimes we see incidences of cancer go up because more people get screened, not fewer. But in this case, it's because of less screening. All right, one more thing. Researchers have found that testing a person's blood for a specific type of protein could really help in screening for Alzheimer's disease. There's been a lot of exciting news on the Alzheimer's front lately. Where do we place this in here?
Yeah, this is promising too. More data is needed, but the initial results show that there's a very high accuracy for this blood test that detects a specific type of protein, p-tau, that is linked to Alzheimer's. And this, it actually can happen before patients develop cognitive impairment, mild cognitive decline as the first initial stages, which means, Tim, if they will benefit from immune therapies, there are 2 that are approved for Alzheimer's, that's great. And, patients can start preparing what needs to be done. And we can just be better prepared how to manage this condition if this indeed becomes, mainstay, if it gets approved. More data, like I said, is needed, along with more diversity-related data in the general population.
Okay, but interesting. And if p-tau is related to just general tau proteins, that is also the mechanism behind chronic traumatic encephalopathy, CTE. That's the brain disease that hits a lot of athletes, a lot of football players, a lot of contact sports there. So it seems like they're going down the right direction with that, at least in terms of research.
Right.
Yeah, that is great. All right, Dr. Syed Hussain, thank you so much for the knowledge.
Sure.
We appreciate it. This is why we do this every Wednesday at 8 o'clock, guys. Symphony, let's send it back to you.